According to the World Health Organization's Obesity and Overweight Fact Sheet, published in 2003, globally there are more than 1 billion overweight adults, at least 300 million of them obese. Weight management has become an important health issue for most adults in many industrialized nations around the world. For instance, a leading medical journal states that over 60% of adults in the U.S. are overweight, with 30% fitting the criteria for obesity. Despite the fact that there are many popular weight loss programs, the obesity epidemic is only getting worse. This is a very serious health issue since obesity is known to increase the risk of heart disease, some forms of cancer, diabetes, high blood pressure, and stroke. WorldWatch states that for the first time in human history, the number of overnourished or overweight people, 1 billion plus, matches the number of undernourished or underweight people. Unfortunately, many weight management programs fail because they are geared for temporary or quick weight loss of a few pounds, which often is primarily water loss. Additionally, they tell you what they think many of you want to hear, such as, eat whatever you want on our program, or all you have to do is take our tablets. But if these programs were effective, would our obesity problems still be getting worse? Isn't it time to get serious about our health and take responsibility for it? Essentially, all current scientific and medical literature would say emphatically, yes. The NUTRILITE Health Institute and Trim Advantage present the Trim Body System. This program is a series of steps to help you manage your health, your diet, and your weight management. Now it's time to begin, be fit, and believe. Let's begin with Dr. Duke Johnson from the NUTRILITE Health Institute. He has examined more health assessment blood tests than any other doctor in America and is considered to be an expert on the relationship of diet, weight management, and health.
Hello, my name is Dr. Duke Johnson, and I'm the medical advisor to NUTRILITE Health Institute. Initially, I was trained as an emergency physician, but changed to preventive medicine 17 years ago after diagnosing heart attacks on people in their 30s and 40s. This phenomenon of heart attacks and chronic diseases occurring at an early age needs to be prevented. The World Health Organization states that there's an epidemic of diabetes and obesity occurring around the world. The two reasons for these epidemics occurring are often interconnected and related to our lifestyle. A number of years ago, a 39-year-old male by the name of Bob came into my office, and he said, "Dr. Duke, I'm concerned about something. Will you please check it out?" For months, as I've climbed stairs, I've gotten short of breath, and I had a doctor check it out 6 months ago, and he couldn't find anything wrong. Well, based on his symptoms, I decided to check his heart and found that he had 2 severe blockages in his coronary arteries, so severe that we had to take him to open-heart coronary bypass surgery the next day. What I'll never forget is the night before his surgery, he called me at my house from his hospital bed, and he said, "Dr. Duke, I need to ask you a question. I'm not going to die, am I? I have 2 small children. I'm not going to die, am I?" I said, "Bob, no, you're not. We've got you in the hands of the best surgeon around, but there are some lifestyle qualities and characteristics called risk factors that brought you to this moment, and we're going to need to change them." Well, what I'm happy to report is that Bob came through his surgery very, very well, and he's made those risk factor changes. And those same risk factors, qualities and characteristics, I'd like to teach you to help prevent you from getting heart disease and cancer.